Dr. Ankita will be discussing with you very important topic, that is preterm labor. As we all know that we are celebrating a preterm labor month. So we should know what is a preterm labor first. As we all know, when there is an onset of regular uterine contractions associated with the cervical effacement and cervical dilatation after the viability of fetus and before 37 weeks of gestation is known as a preterm labor. I was also shocked to know that India is ranked number 1 in having a preterm labor. The prevalence of preterm labor is 11.1 to 16%. So why we are bothering so much? Because preterm labor is having short-term as well as a long-term complication for the fetus. There are certain risk factors which help us to find out that these pregnant patients might land up in a preterm labor so that we can treat them earlier. So first I will tell you what are the risk factors. The risk factors are, first, whether they could be a teenage pregnancy or it could be an elderly pregnancy. They could be undernourished. They could be a smoker. They can have a previous history of a preterm labor. They can have cervical incompetency or any kind of cervical surgery done. They could have any infections in the body like urinary tract infections or a vaginal infection or any tooth infection also, which can help to increase the chance to have a preterm labor. Another risk factor is twin pregnancy or a multiple gestation, over distended uterus, which we call. Then we will be discussing now what are the complications which I was telling you. It could be a short-term or a long-term complication. Short-term complications like fetus can have birth asphyxia, respiratory distress syndrome, they can have neonatal sepsis, and the list goes on and on and on. The long-term complication, these children are more prone to have cerebral palsy. They will have some behavioral difficulty or intellectual difficulty, learning disabilities. These kids are not only burden for themselves, for their families as well as for the nation. So we have to find out which pregnancy lands up in preterm labor. We have to try to reduce. So the warning signs which we should tell the patient, when they see these signs, they should immediately come and contact their OBGYN. The warning signs are mild abdominal discomfort or pain, certain pressure in the abdomen or the pelvic region. Third, increase in the amount of vaginal discharge, or it could be excessive vaginal bloody or a whitish discharge, mucus discharge, and constant dull aching backache could be there. By seeing all these warning signs, patients should immediately come and contact their OBGYN so that a prompt treatment can be done. Before ending the talk, I would like to tell you that preterm labor has to be managed and balanced by seeing whether delivering a fetus is advantageous or trying to increase the gestation is advantageous for the fetus as well as for the mother, because we have a lot of tocolytics or steroids which helps to increase the gestation and try to reduce these complications of preterm labor. By this, I want to end my talk and thank you so much.